Regarding the treatment options, generally there is a lot of confusion amongst the patients. So I like to divide the treatment options into two broad classifications. First of all being the treatment options which include to halt the progression of the disease, which is very important. And secondly, which is equally important, is rehabilitating the patient in terms of the visual prognosis. That is improving the vision in the eye with keratoconus. So for halting of the disease, which is the first step, it includes collagen cross-linking with riboflavin, which is commonly called as a C3R procedure. In collagen cross-linking, we use a special type of laser radiation which causes strengthening in the part of the corneal stroma and halts the progression of the disease. To be very clear, this is not to improve the vision in the patient's eye, this is just to halt the progression so that the changing of the glass prescriptions stops and the corneal thinning stops. Once the corneal thinning is stopped, we have confirmed that the cornea is stable in nature, structure is good and firm, then we can go ahead with the visual rehabilitation part. For the visual rehabilitation, we can go with a variety of contact lenses, a specialty contact lenses which are tailored to the specific eye of the patient, which can give them an excellent prognosis. There are other specialty surgeries available in today's day practice, which include intrastromal corneal ring placements, which basically acts like a belt. So the cornea is protruded in the form of a cone, as we have already discussed. So we apply the intrastromal rings in such a way that it belts around the cone, and like a belt which is holding a trouser, it will just pull the cornea back and keep it stable so that the patient's glass prescription does not fluctuate. And lastly, in very advanced cases where the keratoconus has gone to such a level where we cannot perform either a corneal cross-linking or any other procedure to stabilize the eye, we need to go for a partial or a full thickness cornea transplant, which is called a dark surgery or a full thickness penetrating keratoplasty.